Yeah, a lot of talk about health care. In Rhode Island, there is some murmur about single payer.
The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
You know, this whole single payer health care conversation is mind-boggling because instinctively a lot of us fight it. And then when you get down to it and you start, picking apart some of the concepts in health care and what we want, you might think to yourself, I don't know, maybe not such a bad idea. So while I'm not leaning that way, I have all sorts of weird inclinations to lean that way. Does that make any sense to you? State Representative Aaron Regunberg is our guest, along with a doctor who will head up the Rhode Island physicians for one single payer plan thing. It's a long sort of tile, but Dr. Ryan is here and he will talk to us about coming up. How are you? I'm mumbling tonight. When it's humid in here, I'm mumbling. Let's go to the rundown. Speaking of mumbling, I mean, that's finger mumbling, I guess. Hashtag. What did the president try to say here? Nobody knows what the tweet was. Late night tweeting by the president. Now we know he doesn't drink, so I don't know. Maybe he was just tired from the trip. In the meantime, he's pulling out of the Accords, and here's the latest from the network.
President Trump is ready to make good on another campaign promise.
We're going to cancel the Paris Climate Agreement.
He tweeted this morning, I will be announcing my decision on the Paris Accord over the next few days. He's planning to pull the U.S. out of the landmark global agreement between almost 200 nations. Former President Obama played a large role in negotiating the 2015 pact to voluntarily cut carbon emissions.
History may well judge it as a turning point for our planet.
President Trump has been working on reversing some U.S. climate change policies since taking office, but some of his top aides have been divided on the issue.
The president met with EPA Administrator Scott Pruitt Tuesday, who has questioned whether humans are to blame for global warming. And Senate Majority Leader Mitch McConnell and 21 other GOP senators sent the president a letter last week urging him to ditch the agreement. Democrats say leaving would be a historic misstep.
It would damage our standing on the world stage and allow China to take the moral high ground.
In Italy last week, G7 leaders also pressed President Trump to stick to the agreement. Exactly how the U.S. will pull out or whether the president may try to renegotiate part of the deal is not yet clear.
Yeah, well, when is it ever clear? I don't know exactly what the end game is here, and it seems to me that the end game never appears until you get to the end, but there are many steps to get to the end. We'll just have to stay tuned on this. I mean, this is one of those things the president could end up reversing himself on when he finds himself with no answers about anything, and then he finally realizes he has no answers about anything. Meanwhile, the whole world has conceded, except for a couple of, conservative talk show hosts, that the place is getting warmer. It certainly is in the studio today. We'll investigate that as well. Let's check out the things happening here in Rhode Island. The car tax shifting. That's Lexi's creativity tonight. The speaker says the people want it. The speaker has to admit that he was in a deadlocked race in District 15 and they needed something exciting to talk about. And so he laid it out. Because I got to tell you something. I brought this to the people on the radio weekdays 3 to 6 on WPRO yesterday, and I got a collective yawn. Anyway, the speaker's kind of excited about it.
I am delivering on a promise to begin the phase-out of a regressive, oppressive tax. It reimburses our local cities and towns for any revenue loss, so there's no local impact, and it addresses all of our main principles that we intended to address. This is really, one way or another, the people's money, and the people have demanded this, the people expect this, and we are here to serve the will of the people.
It's like Evita. The people want the cart. Come on, Nick. The truth of the matter is that look, nobody likes the car tax, but the procedure by which he's reducing it is footloose and fancy-free. There's not a lot of savings for not a lot of people early on, although there's still $26 million worth of put from the state government into the local municipalities so they can afford to be able to take a local hit, because that's where the revenue goes. to the local municipalities. We'll break down all of the differences between that and the governor's proposal, which more or less is probably dead. All I wanted to ever do was to copy what Massachusetts does. Make it even, make it equitable, make it easy to understand, and make it semi-affordable. But I don't know. 6 years is a long way. I think most people are yawning because we've gone through this before and it didn't bear out. We'll see. All right, let's go to the hunger strike reminder here. So earlier today, we had a discussion on the radio about this. This is what, day 12 now for this woman, Pilar McLeod, who has decided she's not going to eat anymore until this gentleman, Jim Vincent, the president of the NAACP here at the local chapter, resigns. Now, it's an internal squabble, and we had a conversation about it here last night, and one of the advocates for the ouster of Mr. Vincent is Ray Watson, who is not a paying member of the NAACP, but he was here with one yesterday. See if you can make any sense of this.
It isn't just a couple of people complaining that something's happening with an institution in Providence. These are well-known and acknowledged community activists and leaders who are going to such an extent. So when I hear that as a community member, I have to pay attention, because I know Noel, I know Pilar, they weren't just haphazard. I mean, to your point, a hunger strike is something. So what would push someone to the point where they'd actually go on a hunger strike? I, as a concerned community member, need to be aware of that and need to hear that. And what bothers me, to Noel's point, is when a request is put out there to come and answer questions from the community, and A, they don't show up, but then B, we're also told that we have to speak to someone in Connecticut. I'm not liking that situation at all.
Did you get all that? This is a problem. Look, they don't trust the money. They're looking for an audit. They can't get an audit. Jim Vincent, the head of the NAACP, is saying everything is cool. I don't know what they want. This is an internal squabble by some disgruntled people, but this woman's not eating now, day 12. Here's the response from Jim. I don't expect you to read all that, but for the most part, he says these allegations are false, defamatory, and unsubstantiated. We'll keep working on this thing. Look, you know, it's almost like yelling fire in a crowded theater when you decide to do a hunger strike for something that seems to be an internal squabble, but that's what she's doing, and at some juncture, Mr. Vincent's going to have to just, you know, pick up the phone and go see her and try to talk this thing out. Communication is always the best medicine, it seems to me. All right. In the meantime, come on, Kathy Griffin, really? Headline here, and then this just ridiculous apology.
Way too far. The image is too disturbing. I understand how it offends people. It wasn't funny. I get it. I've made a lot of mistakes in my career. I will continue. I asked your forgiveness, taking down the image, going to ask the photographer to take down the image, and I begged for your forgiveness. I went too far. I made a mistake, and I was wrong.
Did you apologize to the president? No. You just didn't like the reaction. CNN has a relationship with her, right, Lex? And they popped her. All right, well, live and learn. It's a tough line, that comedy thing. But you'd have to be a functional idiot to think that that's not over the line at the concept, right? All right. Obamacare repeal has been the theme for the Republicans, of course, right? We have headlines like this. And then we have responses like this, a bill in the General Assembly, which is being held for further study in the House right now, but its author says, survey says, that we have some momentum. True?
Well, first of all, thanks for having me, Dan. Appreciate it.
State Representative Aaron Regunberg is here. Not his first time at this rodeo. You've got an interesting set of bills that we should mention as well, but this one is going where? This single-payer health insurance plan thing.
Well, I've been proud to be working with advocates from across our state to really push this legislation that would create, as you said, a single-payer Medicare for all style healthcare system in Rhode Island, one that would recognize healthcare as a fundamental human right rather than a privilege for those who can afford it, and we believe one that would bring a much more rational, affordable, effective approach to our healthcare system. The reality is right now, our private health insurance system is not working very well. We've had some really important, critical steps forward under the Affordable Care Act. We have more people insured than we had before, and that's that's urgent and needed, but we're still the most expensive healthcare system on the planet. We still have folks who are not able to access care either because they remain uninsured or because they're underinsured. They are forgoing medical services that they need because of high deductibles. And we're still number 27 when it comes to life expectancy of developed countries. So there comes a time when you have to wonder, are we using the wrong tool from the toolbox? Is there a better approach? And do some of those other countries that have better health outcomes than us have systems that maybe we should be looking to?
All right, well, that sets the table. We'll come back and continue with the state rep and a local physician who's got a lot of answers on this. Stay with us.
Have better health care at a lower cost. And now I'm calling on the Senate to take action.
The Senate said, more or less the idea was dead in the water, so I have no idea how this whole thing is going to go. Doc, welcome. Dr. Mark Ryan is here. He is the Rhode Island Chapter Physicians for National Health Program Advocate. You just met Representative Regunberg. Why did I say Ehrenberg? Did I say that all the time?
I actually get that all the time.
How many times did I do that?
No worries about it.
I know a bunch of Ehrenbergs. Dude, if someone calls me Yorkie, I say, hey, stupid. Did I do that twice or 3 times today?
Don't worry about it.
Regunberg.
All right.
All right. Gosh, you shouldn't let that go, especially if you want to run for statewide office. They wouldn't know who to vote for. Are you running for statewide office?
Oh, God, let's talk about single payer.
Okay. Doc, welcome.
Thanks for having me.
Ryan's easier.
Oh, yeah.
Ryan.
Exactly.
Oh, God, help me. Welcome. Is this organization you represent vast amongst the medical community or a niche?
Well, there's currently there's 20,000 members nationwide. There's chapters in pretty much every state. In Rhode Island, I think we've got 81, 82 members now.
Versus how many docs?
Oh gosh, I'm not sure the total number of doctors. Yeah, thousands.
Yeah, right. So, represent for me what your organization's impact is inside the medical community before we talk about the bill.
Well, that is how PNHP, Physicians for a National Health Program, was formed. It was basically formed by a number of physicians who were doing research into healthcare funding, healthcare outcomes, and realized that most of our colleagues, and I was certainly one of them, really don't know very much about these topics. It is not taught in medical school. It isn't taught in residency. We focus on patient care, but the funding mechanism isn't something that really anybody knows about. So PNHP's original mission was to help educate the medical community. As time has gone on, it's obviously broadened its mission because the data, at least we feel, is so overwhelming that it becomes very important that I think we get these data, this information out to as many people as possible, because we are badly in need of reform in this country.
Yeah, I got some pretty good docs here in Rhode Island who will talk shop with me. I go in for my checkups, but that's me, right? Talk to me about Obamacare. I want to know what your perspective is. And it kind of changes year to year. And of course, obviously, with this repeal thing, nobody really knows what to say because nobody really knows where it's going. I mean, whether you're a state rep, a doctor, a talk show host, or whatever, right? So it's a little bit of a mystery. Let's run through some data, and then we'll talk about what could happen here in Rhode Island. Aaron, pipe in if you want to. Let me just see some number of uninsured Americans from 76 to 2008. This is your chart, right?
Yes.
So shoot.
So I basically brought this one in just to kind of frame the debate, remind people why it is we've been struggling over healthcare reform pretty much for the last 20 years. And this is one of the big reasons, which is prior to the ACA being passed in 2010, we saw pretty much an inexorable rise in the number of people who had no health insurance at all. And we know the lack of health insurance leads to morbidity and mortality. Despite what we heard in Idaho a couple of weeks ago, people who do not have access to health care do die. So there is a need for some sort of reform. This was part of the background that pretty much propelled the ACA into existence.
Next chart. Survey says, take a look at this. Public spending per capita for health is greater than total spending in other nations.
So you look at, these are 5 representative European nations and Japan up at the top, and how much they pay per year per capita. So how much they spend on each individual citizen for healthcare. the bar at the bottom is the United States, and the yellow part of the bar shows how much we spent publicly. That includes Medicare, Medicaid, the VA system, tax subsidies for corporations that subsidize their employees' health insurance, all of it. And with just looking at the public expenditure, we already pay more than any other country on earth per capita. When you add on the amount of money that's being privately expended, we almost double any other country as far as the money we spend each year on our citizens.
What are those countries doing in terms of research and development? Not as much as America does.
It varies from country to country. Give you an example, the CAT scanner was not invented in the United States, it was invented in England. A lot of the pharmaceutical research goes on in Japan, Italy, Germany. So they do research. We do as well. Fortunately, we haven't so far decided to cut NIH and CDC funding, although that's been discussed.
We've got another chart or two here we're going to zip through. Insurance premiums, workers' inflation, 99.08.
So you see here two little lines on the bottom. The bottommost one is the rate of inflation over this period of time. The line that's barely above it is the average rise in worker income. And as you can see, most of it is being eaten up by inflation. The red line up at the top is actually the average price of health insurance premiums, which has been increasing at 5% per year. And is vastly outstripping either inflation or workers' wages. The Congressional Budget Office, in fact, tells us we're kind of facing a horizon here, because by 2025, if nothing changes, the average cost of a commercial plan, health insurance plan for a family of 4 will equal roughly 50% of that family's annual income, which is obviously not affordable.
And what's this number on physicians and administrators? What's this all about?
So this one is just to kind of give you an idea of where the money is going.
Not many more doctors, but a whole bunch more.
And the only reason why you can even see the yellow at all is that it's so dwarfed by the blue.
Sure.
They just thickened it out of proportion to the graph so that you could see it. So that over this period of time, the number of physicians in this country rose less than 2%, but the number of people who are involved in the actual administration of healthcare, the paper pushing, the form filing, rose 3,000%.
And what's the maternal mortality number mean to us?
Which mortality number, I'm sorry?
The one that you gave me here, this last chart.
Okay, the mortality rate. So the last one, there's a lot of different graphs looking at how we do as far as delivering health care. Representative Regunberg alluded to one, which is our life expectancy is lower than most other countries. This is one of the more, I think, appalling ones. The yellow line is the United States. The green lines are other countries. The one on the far right is Australia. This number represents the number of women who die giving birth. And in our country, women die 8 times more frequently than they do in Australia.
Now, what's the breakdown on the number of uninsured? It seems to me that the number of uninsured would be extraordinarily high versus the number of insured.
Yes, you're right. It's
correct?
not only the uninsured, it's the underinsured as well. But you're right. When you look at individual populations, for instance, farm workers in California, because they are moving all the time to follow where things are being harvested, don't have consistent access to health care. So a lot of very serious maternal conditions are not diagnosed because they just don't have regular medical follow-up. So in those populations, the numbers are even higher. This is an average.
It's not all the pertinent data, but that's a bunch of it. We'll come back and explain what the idea here is in Rhode Island. Stay with us.
We will make sure that Trump Care doesn't pass the Senate and can't hurt the American people.
All right, so we have that stalemate, and after you met Dr. Ryan and all of those numbers and data, we come back to Representative Regunberg and say, amidst the federal logjam here for reform, you want to slip in what here in Rhode Island?
Well,
go on our own here? I mean, we have a health exchange that's working better than most in the country at this point, at least with the current funding out of Washington and the Medicaid and all that kind of a thing.
So I think there are important pieces of the conversation in the single-payer bill that apply with or without the D.C. conversation, but that really puts some urgency into this. Republicans are determined to try to dismantle those protections we talked about with the Affordable Care Act, and if that happens to even a small degree, that's going to have a huge impact here in Rhode Island. Throw in 23 million Americans off of health insurance, having a devastating impact on our state services, our state budget.
The CBO score, the Republican response to the CBO score is, well, look, there'll be less people who are forced to buy health insurance. Certainly there are folks who are going to be not qualifying in the Medicaid formula because the Medicaid formula change that's proposed out of the House. You know, Paul Ryan says that $23 million number is nothing to get upset about. There are a lot of people who just don't want to buy health insurance who just won't have to anymore. So that's kind of built into that number, right? Yes.
I mean, that's a big number, and there's going to be a whole lot of people who are going to be hurt by that, including in Rhode Island, and it's going to impact every aspect of our system if that happens. So that's why I think there's extra urgency to this conversation.
So specifically, what do you want to do here? Then we'll ask a little bit about philosophy real quick. Go ahead. Tell me what do you want to do specifically?
So the idea is to create a whole new single-payer system where we're cutting down on all those administrative costs that Dr. Ryan talked about.
For everybody, birth to death?
Exactly. According to now obviously that's a big proposal, it's not a small thing. There's going to be a cost to that, but the analysis that we've had done on the legislation by an economist at the University of Massachusetts, Amherst, found that when you add up all the costs and burdens that our current system has on individuals, from high copays, high deductibles, on businesses, we don't talk about how somehow in this country we've slid the responsibility for health care onto employers, which to me is ridiculous. I'm glad that so many employers step up and do the right thing and provide it, but that's something that other countries don't have to deal with.
Yeah, so you want to change the culture. We're going to have to get down to the nitty-gritty. Your bill was held for the study, meaning nothing's going to happen this session most likely, but you think you've got some momentum. Why?
There definitely feels more energy this year. I think a part of that is because of the fear over how the national conversation impacts us, and if there are changes coming from DC, you know, we can either take steps backward because of the lack of resources, the changes, or we can take steps forward by having new creative modes for how we approach health.
So here's the philosophy conversation that we have 2 minutes for. You started at the beginning, right versus something that some people can't afford, or that some people can afford. Right versus products that everyone ought to be able to purchase, I think is a better frame for this conversation. Is health insurance a right in this country? I'm guessing your organization says, heck yes.
Well, Charles Krauthammer now agrees with me. On Fox News the other week, he was saying that because of the way the conversation's been going, more Americans now view access to health care as a right rather than as a commodity to be purchased. Insurance is a commodity, but access to health care, we believe, is a right. Because as we know, and despite what we've heard from some people, people who do not have access to health care die. And, you know, again, the Constitution guarantees us life, liberty, and the pursuit of happiness. If we are deprived of the right to life, one of our constitutional protections has been taken away.
Yeah, it's going to be funny if we fast forward the calendar 20, 30 years here. We might inevitably end up where you are. It's a question of how we're going to get there on either a national or a statewide basis. You're trying to drive the conversation from a 1 out of 50 place rather than out of Washington, more or less, correct?
The concern is that if we leave things to Congress right now, to DC, they're not going to happen. There's a precedent for these kind of systems originating from the bottom up. In Canada, it started with one province that adopted a province-wide system. We want to do the same here in Rhode Island and be a leader for the country.
All right, when you get some momentum, let us know. Doc, come back with more data when you get a chance.
Always happy to.
By the way, I got the sniffles. Can you stick around? Final word when we come back. Stay with us. Hey, we got a comedian tomorrow. Who is it? The guy from the Colbert Show? Why are we getting people who compete with me? That's my market share we're talking about. I'm right there with Colbert every night. Oh, I shouldn't mention him because then you go, oh yeah, I don't want to watch the fat guy on TV. Let's go watch Colbert. It'll be fun. We'll see you on the radio tomorrow at 3 on WPRO. Good night.